Here we have a scapula, and then you can see this is the anterior view. We have our superior angle and our inferior angle, the medial border. So if we put that in reference to the whole body, you can see right here, medial border, superior angle, inferior angle. Okay. We're looking at the anterior surface here. There's that glenoid cavity or glenoid fossa, and the head of the humerus would articulate right there. Now this is called the costal surface because you can see how if we put this on the rib cage, that's where that gliding joint would articulate, and it would glide over the surface of the ribs, just like this one is here. So we call this the costal surface. Also, that is the subscapular fossa, because the subscapularis muscle, which is part of the rotator cuff, also originates there and then attaches to the tubercle, the lesser tubercle of the head of the humerus.
What is the name of this muscle? Thoracicus. Whenever brain farting. Why can't I think of it? Why am I such an idiot?
Thoracic nope.
No, why can't I think of it? I feel like I'm totally being a brain fart right now. Anyway,
this is the worst video ever. Transversus thoracis.
Transverse thoracic.
Yes, transversus thoracis. Okay, back to this. So we have these ridges here. They are the oblique ridges. On some of your specimens, you're not going to be able to see that level of detail, but you can also see this rough area. That's where that subscapularis muscle is attaching and is then going to come over here to the lesser tubercle of the head of the humerus. Now we have our superior notch. We also have our coracoid process. So that's going to be the attachment site for one of the heads of the biceps, one of the pectoralis minor, and your coracobrachialis. Think coracobrachialis running down the arm. So again, what your muscles are called sometimes are going to tell you those attachment sites. Now let's look here at your glenoid cavity. You have your supraglenoid tubercle, which is where the other head of the biceps attaches. And then we have our infraglenoid tubercle. So think if the biceps head attaches up here, one of the triceps heads is going to attach down here to that infraglenoid tubercle. And then you have the glenoid cavity itself. Let's take this over to the posterior view. You can see that lateral border there. Again, your superior and inferior angles. And then we can see the acromion. Some will say acromion process, but the acromion and then your spine of the scapula. That's what lets you know that you are looking at the posterior view of the scapula. Up here we have our supraspinous fossa, which is where the supraspinatus muscle of the rotator cuff attaches. Here we have our infraspinous fossa, which is where the infraspinatus attaches. And then down here you can see where teres minor also attaches. So infraspinatus and teres minor, remember they are married. They do everything together, and they're both going to originate from here at these two places on the scapula, and they're going to go to the posterior aspect of the greater tubercle of the humerus. This guy, supraspinatus, is going to originate from that supraspinous fossa, and it's going to come up over to the top of the greater tubercle of the humerus for abduction. And then we're in abduction. That infraspinous is going to pull that scap back down along with teres minor, because remember they do the same exact thing. Real quick recap. Anterior view, superior border, inferior border. Oh, sorry, angles. Superior angle, inferior angle, medial border, lateral border, and you could call those borders as well, but they're more often referred to as angles because of that angular shape. We have the costal surface, also known as the subscapular fossa. You have your oblique ridges, which are just those sites of attachment for the subscapularis muscle, coracoid process, superior notch, glenoid cavity or fossa, supraglenoid tubercle, infraglenoid tubercle, posterior view, spine of the scapula, acromion, supraspinous fossa, infraspinous fossa, and that's going to be your site of attachment for teres minor.